A very warm welcome to our final session of day one of this H2O open house, where we will explore technology in the context of H2O and the partnership required to make data flow safely and effectively. My name is Nick Carney, and it's a pleasure to facilitate this session. And we're thrilled to have such a large and diverse audience joining us today. But before we dive in, a couple of quick housekeeping points. First is a reminder that today's session will be recorded. And second is an invitation, and that's to use the Q&A functionality on the Zoom platform to populate your questions as we run through the session, and we'll weave them into our dialogue and discussion. Now, we want to cover a lot of ground today, so you'll hear very little preamble from me, except to say that digital health technologies that empower patients and transform healthcare delivery are really fundamental and at the core of the H2O mission and philosophy. And I'd just like to quickly give you an overview of the order of proceedings for today. So we're really thrilled to have with us 4 leading innovators in the digital health space, whose organizations work at the intersection of digital technology and health outcomes measurement. And they're going to join us for a panel discussion. Expect a really lively discussion and debate where we're going to dive into some of the challenges of working in this space, as well as crucially the value that we can create for patients and healthcare systems. And crucially as well, the power of a partnership in allowing us to scale the H2O health data ecosystem. But first, I would like to invite to the virtual stage Matthias Rose and Tom Metcalf, who co-lead all things technical on the H2O project. And Matthias is first going to tee up the discussion and set some context today by placing technology in the context of the use cases of the H2O system for health data. Over to you, Matthias. And I believe you've maybe got 1 or 2 slides you would like to share with us. And Matthias, sorry to have to remind you, but you're on mute. We still don't hear.
Sorry.
Oh. No?
Yes. Yeah, no,
okay.
no.
Loud and clear, Matthias.
Just say it again. Say it again.
Thanks again for the nice introduction and your help, as always, to support us here that everything goes fine. Yeah, it's a great pleasure to be on this session with all of you. And maybe for the audience which is sitting out there, is just to give a little bit of a background, because when we started the project, we knew that myself coming from the the instrument development side, that this is more or less doable. But what is really the missing gap is it is essential to invest in technology to give the patient a real voice. And we heard this I think in the first session, that is technology. And I think when we started was we were thinking of, well, we do the development of the technology ourselves because we have people in the consortium who have done this for scientific use more than 20 years ago, came up with some kind of ePro systems. But then, by building the project more and more, we realized that, well, that probably is not the best approach. So because there are, many, tech companies who can do this much more better and on a much larger size, that, our role from the H2O project is much more to build the ecosystem. So to define maybe the space where we can all, put our expertise on the table. And this means the academic expertise, from instrument development maybe side, or from how to engage patients, how to ensure respondence rate, so which is a scientific endeavor, and the industry partners, their knowledge about scalability, and together with the field of the people who have substantial knowledge in the field of capturing the patient's voice. So we gradually understood that there's much more to be gained, and to do it together, what none of us can achieve alone. And so that was the development, I think, from the H2O project in general, but in particular also for the tech field. So to leverage the enormous potential, obviously, of aggregated analysis or for clinical decision making, this was the idea. And maybe just to give a little bit of only 2 slides, how we think at the moment is, I can show this here, is, well, this is a slide where basically I try to demonstrate many times that what is the, you know, the magic maybe to say in the end, how we can create a win-win-win situation is how to combine the different interest groups in patient-reported health data. So we heard this morning, you know, from Linette, who's gynecological surgeon from Erasmus, that they want to use this like laboratory data to inform clinical decision making. And we heard from the patient how they would be interested to, you know, to know their, you know, health status in comparison to other patients. So that's the left side, so to say, on individual data scientists. And then obviously, which we would consider the knowledge gap, is to have real world data evidence, and maybe at some point even RCTs and real world data evidence, which cannot be achieved in any means at the moment by none of the endeavors which we are doing. And then obviously we have obviously interest here for people who are coming from the field of quality assurance. So when the first things, or where we think it right now, and maybe it's just as a rough summary, obviously, is what the observatory will be, is first of all, you know, might be a central place where the PRO data will be collected coming from the patient solution partners, or and then obviously this is just the PRO part. This could be in one way directly, like, you know, like this be done on the usual way, or via the observatory inform clinical care. But to make, you know, scientific use of it, obviously the PRO data alone doesn't help a lot to interpret the outcomes which we are interested in. So it needs to be linked to the data which are there in the EHR system, or coming from the healthcare providers, if we think of use cases like diabetes. So they needs to be linked, the PRO data, and also be part of the observatory to use those kind of information together for academic researchers, or life science industry, or HTA agencies, to have those kind of huge European, and Beate Wiesler from IQWiC was just mentioning this maybe 30 minutes ago, how useful it is, and in Germany it's even in the law, to have a European data space where you can draw those kind of information together, which is not available at this point. So, and this is obviously particularly important for some of the more rare diseases. So this is the way we think at this at the moment. And so we hope that whatever we do together is the win-win situation. And as I just mentioned, I think we cannot be successful, certainly not us as one of the partners, so but we can be successful, I think, if we do it together. So I don't know, Tom, if you want to add on this, or that I lost something or didn't mention something.
No, I mean, I think you've described I guess the overall challenge that we're taking on, and some of the technical underpinnings to this, Matthias, but maybe to sort of lead into why we decided to work together with partners. And I think you alluded to this, Matthias, that we've relatively quickly, in the course of the project, I think within 6 months of starting the project, we came to a point where we could either try and build the patient-facing functionality that we require to generate patient-generated data, and all of the capabilities which we would need to aggregate that data. We could either choose to build that within the project, or we could take a different route and essentially collaborate and partner to achieve this. And if we'd have gone down the initial route, our view was that it would take quite a long time for us to build all of this the functionality that would be required, and that we would also essentially be competing with people who were working in this field and doing excellent work in this field unnecessarily, because we don't, this shouldn't be, from our perspective, a competitive undertaking, but much more of a collaborative undertaking. And this is what led us to, I think it was in September of last year, to essentially put out a call for requests for expressions of interest to partner with H2O, with the Health Outcomes Observatories project, to people who are already working in this space and sometimes for many years collecting outcomes data, and who also have developed many of the wide range of functionalities which patients are looking for in terms of patient-facing applications. So these are things like disease management tools and disease information, which patients who have chronic life-changing conditions, that they want to access, as I said, to a relatively wide range of functionalities, and not just to a widget which collects a very specific set of outcomes data or patient relevant data. So this is what led us to the decision to create this request for expressions of interest, and we were extremely happy with the response we've got from people who are working in the outcomes collection space, and who represent the cohort of potential partners who we have on this panel today. And in fact, we've got I think a subset of our potential partners here on this panel today who represent I think quite complementary capabilities, but we're actually talking to a wider range of potential partners, and we hope to be able to enter into formal partnership agreements with these partners in the coming months to and I think, Matthias, you referred to this, to enable us to scale this undertaking quickly and to very quickly get in place a set of patient-facing applications which will allow us to collect the data that we want for the health outcomes observatories at scale.
Thank you to both Tom and Matthias for your perspectives and really nicely teeing up the panel discussion. At this point, I'd like to invite our 4 prospective partners to the virtual stage as well. Now, we have some really meaty themes that we would like to tackle and dive into together. But first, I'm going to abdicate on my responsibility of, as the host here, of doing introductions, and really ask each of our panelists first to tell us a little bit about themselves and their organizations. And in no particular order, but just to make sure that I can choreograph this here, I'm going to go Valerie, Nadir, Pedro, and Tim. So first, over to you, Valerie.
Thank you, Nick. Thank you very much. And yeah, thanks for an already very interesting afternoon. So I've listened in since 2 o'clock. Can you guys hear me well? Because I have like elaborate technical setup here. Perfect. So my name is Valerie. I've worked in the space of patient-reported outcome measurement for quite a while. I would say like half a decade, a little bit more. I came upon the concept actually when I worked at the Charité, where I worked as a pediatrician. And there, just doing my clinical work, I always was dissatisfied with the situation that we just treated patients with the best of our knowledge and like based on guidelines and everything, but never knowing what actually happened to the children in my case that we treated. And so when I came across this concept of patient-reported outcomes, I then was able to start a small working group and actually implementing this at the Charité. So we heard from the breast cancer patient and physician in the morning. So we also started in this disease field at the Charité, and we're able to slowly roll it out there with the academic expertise in the background of Matthias Rose, who's here on the call, which made it a lot easier. And then last year, I moved to a company now where I'm solely focused on patient-reported outcome measurement. We're called Heartbeat Medical. We mostly work in the German-speaking region, which we call the DACH region, Germany, Switzerland, and Austria. And I think I'd leave it at that to just give a little bit of a background as to who I am. And next, I think was Nader in your, right?
Perfect. Thanks, Valerie. Yes,
Good.
I'll pass over to Nader.
Great. Thanks for the handoff. I failed to notice who was coming after me, so I'm not going to be able to do the same. So, so hi everybody. Thanks a lot for having me here today, and really looking forward to this initiative getting off the ground. I'm co-founder and CEO at a company called Ampersand Health. We do clinician in the loop digital therapeutics in immunology and inflammation. My background really is that I don't have much background, certainly compared to a lot of the other people here. I started my career in international development, foreign policy, moved into something more around the intersection of social impact and emerging technology, and have spent 10 or 12 happy years in digital health now, doing various things in the space. So very briefly about Ampersand Health, I guess we're a mission-led organization in some fashion or another, set up by 2 doctors and somebody with a patient perspective on inflammatory disease. Our mission is to light the path to remission for people with these long-term conditions, and we see 4 important ways to do that. At least 2 of them closely intertwined with the mission of this initiative as well. So on the one hand, we think that when clinical teams have the data and the tools that they need to provide more responsive and personalized care, we can keep people out of hospital when we need to, and we can get them into hospital more quickly. And that's clearly the main lever at our disposal for I suppose, helping patients to find that long-term remission. The second piece for us is about helping patients to build the knowledge and the confidence to improve their self-care, using a combination of behavioral science, CBT, and acceptance and commitment therapy. But importantly, we see, again, data as a key part of the motivational device, if you like. And patient-reported outcome measures, while a little bit dry, are probably one part of that, that kind of portfolio of data sources. The last thing that we do is we create community around the platform so that patients with relatively rare diseases can experience peer support and have access to expertise and so on and so forth. So, I think there's a huge amount of value in looking at patient-reported outcome measures and building up perspectives in clinic and beyond. That's really, I think, our interest in this initiative.
Fantastic. Thanks very much, Nadir. And I'll pass over to you, Pedro. And I hope, Tim, you realize that you're next up after Pedro.
Hi, everybody. Thank you for having me here, and also very much looking forward to having this initiative starting. I'm Pedro. I'm a physician by background and one of the co-founders of Promptly. We are a real-world data company with tech products to collect and integrate and analyze data on the outcomes of care. And one of such data points actually that we have pretty much started with was patient generated data and patient reported outcomes. My personal journey with PROs was similarly to Valerie was in my hospital, the hospital that I worked with in. We had a history already with collecting PROs in more than 10 diseases for many years. I was astonished and proud with the work that was already done in the hospital, but at the same time, couldn't stop noticing that feeling that is, we aren't using this at its fullest potential. It was a bit strange that there was so much effort, there was so much investment, and so much proud actually in our databases, in all thousands of patients that we had following up PROs, but at the same time we weren't able to in a perfect way integrate it into the care cycle, in the feedback to the clinicians, in really explaining to the patients the value of that data, and also in integrating it into our business model as a hospital, with our funders, with our payers, in showing all the great work that we did in terms of quality of care. So that was an inspiration, actually. So an inspiration to move into this world, also trying to create together with a physician colleague a company that could help hospitals, payers, pharma and medtech companies to putting these programs in the ground and starting to collect and disseminate these programs. And very fortunately, that's what we have been doing for the past 5 years, very much focused in Iberia and Latin America, especially in cardiometabolic and oncology diseases. And yeah, that's been quite a super interesting journey. We'll speak a bit more about that later. But yeah, very much inspired by the possibilities of H2O as well. So I pass it to you, Tim.
Thank you, Pedro. Yeah, first of all, to echo the others, wonderful to be here. Great opportunity. Thank you very much. So I'm Tim Williams. I'm the founder and CEO at My Clinical Outcomes. I started the business way back in 2011, so been around a few blocks. The system is a patient and clinician-facing web platform for collecting and analysing PROMs in routine clinical practice. So I guess if we had any kind of sweet spot or differentiator, I suppose it is that we're condition and score agnostic, and that we've built over time the configurability and flexibility in the platform to fit it around existing clinical workflows, and hopefully therefore be able to tailor it to local needs, even if there's an overarching regional or national objective. And lots of experience over the years of how to make that happen and live, and to do it in a way that meets people where they're at and understands the constraints that everybody's up against working in healthcare today, in terms of time, capacity and resource. Our very first use case was way back in 2012. We started working with an NHS trust, tracking and monitoring patients after hip and knee replacement. But actually the idea, the conception for MCO came when I've been working both as a doctor and also as a management consultant, and seen from, I guess, both those lenses that there was a lack of real-time, real-world data to help anyone do their job better. Specifically as a management consultant, spent some time working with an industry partner, all about trying to solve the challenge of allowing busy clinicians to escalate patients through the necessary treatment hoops to justify getting them onto end stage products that were often more expensive, and then to create data to justify their ongoing use. So kind of had that dual bit of experience. Was heading off for a career in public health actually, but got sidetracked temporarily and to this day by building MCO. We're, as I say, condition and score agnostic. Started in elective surgery, increasingly do a lot of work in oncology. I guess if there's two engagements that we're particularly proud of that are perhaps most relevant, one is we were selected by NHS Scotland to build out the solution for cancer patients way back in 2017 through a fantastic program called the Cancer Innovation Challenge, where we were funded over 4 years to really deep dive into different clinical use cases. So wrapping the platform around acute chemotherapy toxicity monitoring, around stratifying breast cancer patients over long-term follow-up, screening for signs of recurrence, and how to make all of that interconnected and interoperable. And then most recently, we've had the opportunity to start working with NHS Wales. So NHS Wales, some of you may know, are kind of pioneers, kind of exemplars in terms of adopting value-based healthcare and looking to move towards value-based healthcare at scale. And we've just started working with Cardiff and Vale as the first health board in Wales to procure a region-wide solution. So have the opportunity to work over 3 years to hopefully roll this out to some 50-odd clinical areas. So I think hopefully some relevance to what the programme, what the observatories are trying to achieve, which is this overarching ambition, but also trying to make sense of this and trying to be practical and pragmatic about actually making it work in real world practice at the local level. Looking forward to the discussion.
Fantastic. A big thank you to all of you. I think that gives the audience not only an excellent flavor of who you are, your personal background and journey and what motivates you, but also your expertise in this space of outcome measurements. And I think now what we want to do is really open up the floor, bring Tom and Matthias back in, and really have a lively panel discussion where we can dive a bit deeper into some of these key topics and challenges in this space. And I know none of you are shy, so I know you're not going to hold back in chiming in, but maybe quickly a point on etiquette, if you can, feel free to use the raised hand functionality on Zoom and can help us choreograph on the session. Maybe the first theme, and I think it's one that often comes up in digital health as one of the key challenges that we're facing is, I recognize there's many other themes nested under this, which we're going to get to as well. But I want to throw this one out first to open up the floor on this. And it's really around adoption. And how do we drive, first the implementation of these technologies, and then the second part, I think, is if more critical, is really the sustained use and practice of these technologies. And based on all the expertise and experience and the journey that you guys have been on collectively, I can take a guess and say that you probably solved some of these challenges. And I think I would really love for the audience to hear your perspective on this. So Valerie, perfect. You've shot your hand up first there. So
I did.
Please take us away.
I waited for a bit. I kind of felt like I knew where you were going. So thank you for this great question. And so I want to start with something that I always say about, I work at a technology provider at this point, obviously. Still, the biggest challenge that we encounter is actually that people think prompts are an IT project, right? So you get like an implementation group with the IT guy, which is great because they're great people and they're very important for the project, but they're not the ones who will make patient-reported outcome measurement in an institution or in some sort of landscape ecosystem a success. The first thing and the most important thing is to be aware that this is a project that changes the culture of care. Because as we heard, obviously, suddenly you have a transparency in a data point that has not been there before. It's new and it changes the interaction between patient and physician, between physician and physician. And so many dimensions. So the most important thing is to just be aware of this. And then it's not even a hurdle. You just need to know in the implementation, that's like the most important thing to focus on. And you don't need a large project group. You need, in my experience, something we call a clinical champion. So someone who is like advanced in their medical career. Okay, you are like jumping, the pictures, the people are jumping here, who is advanced in the medical career and says, like, if this is in a hospital, I'm an attending or like someone like this, and I want to push this project, it's mine, I take the hat, like Lynette, for example, who was here before. And then secondly, the second challenge that I think Matthias can elaborate a lot on, and I also have a lot of experience, is that many physicians, and I'm sure there are a lot of them here in the call, still have a view on PROs that is very different on any other metric that they get to evaluate their patient, right? So like before, we also heard this is not only outcomes, it's also an assessment of the state of health. And we have discussions on which questionnaire, which instrument to use that take up a lot of energy and space that we don't have in other areas, right? So the example that Matthias Rose gives here is like, you just want one result if you measure CRP or temperature, whatever it might be, like irregardless of the instrument. So that is also still, even with prompts entering the mainstream, a large discussion. I see the other hand, so I will stop. And just the third thing then is, of course, that I always say is then it's, if you want to implement this, is of course easier to do it like digitally, but really those first two things, culture and knowing what you want to know, is so crucial.
Fantastic, thanks, Valerie. And I was also shocked with the jumping screens, and I have no idea who was first. So I'm going to go to you, Pedro, then Nadir, then Tim.
Okay, thank you. Yeah, I agree with Valerie regarding the fact that at hospitals frequently this is seen as, or sometimes this is seen as an IT program, while this is much more, it's a much more a broader transformation at the hospital than just adopting an IT solution, a digital solution. Our take on adoption from the beginning has been a bit, let's say, risky. We overly focus on patients. So the traditional view that we see even in hospitals that have used prompts in paper for long has been, let's have doctors and hospitals pushing patient adoption, like convincing, even helping, and this for highly motivated physicians is okay, but it takes a lot of time, takes a lot of costs. It's really hard to scale. Our view has been, let's have patients pushing the doctors and convincing the hospitals. And this is, let's try to get as many data from the patients unobstructively and without the need from physicians as possible, and then go back to the hospital and the physician and show, look at so many data that you are getting from the patients, so many information. Look how interesting it would be for you to incorporate that in the clinical pathway and in the flow. I'll pass it on to you, Nader.
Thanks so much, Pedro. Yeah, I mean, you know, in the prep for this session, we agreed that the conversation would be more interesting if we didn't all just say the same thing. So I'm going to stick my neck out and say something possibly a bit unfashionable. I actually think that I agree entirely that there is a culture that needs to be implemented in order to have the successful collection of patient-reported outcome measures in a clinical environment. But I think that that culture, sadly, often follows rather than leads. So in other words, you encounter initial resistance from an overstretched clinical team who say, actually, even if we wanted the culture, we don't have the time for the culture. And so you have to find different trajectories in, and definitely the clinical champion is one. But if I just share our experience, it's quite difficult to socialize widely when you start with a clinical champion. Whereas when you start with the service manager, i.e. the person who's responsible for paying the bills in the department, and you satisfy them that there's a commercial reason or a financial benefit to them and their trust to implementing the pathway change, we find that other things seem to follow quite a bit. So I would say first port of call for us when we think about how do we drive engagement is, can we help to introduce new standard operating procedures that are evidenced to achieve the financial outcomes of a hospital, and then let the culture and the science kind of follow, if you see what I mean.
Thanks, Nader. You've hit on a couple of key points there I want to come back to later, but Tim, I want to pass to you for your perspective on this one as well.
Well, Nader's cleared the way for a bit of controversy, so thanks for that, Nader. I guess I'd actually build on what everybody said. I think in our first couple of years, we started out as clinicians where we saw the clinical opportunity, and it took a long time to work out why sometimes that was met with resistance, because it's very rare that you'll get a group of clinicians in a room who disagree that introducing systematic bronze measurement is a bad idea, but actually translating that into agreement as to what it should look like and how it should be used by the organization, you won't necessarily get straightforward answers. There'll often be anxieties that aren't aired about how the data may be used to change clinical pathways in ways that they're not interested in supporting. And sometimes that creates real project management issues. So I think I'd say what's important up front is clarity of purpose, and that translating into clear leadership and messaging. Clearly, the ideal is that there's the room and the capacity in the organization that clinicians are going to be supported to make active use of this data for the betterment of the care of individual patients. That's the ideal feedback loop, and it's the one that we always aim for, even if actually sometimes that means being less ambitious in the granularity of data that is pursued in the first instance, because there isn't the resource to necessarily respond to really rich data sets being generated on a very frequent basis. So sometimes it's about dialing down that initial ambition. We do have examples where actually clinicians have been less involved, where actually there's been another reason, another purpose behind this that might be commercial or managerial or regulatory. And we've often pushed back actually that clinicians shouldn't be involved, but have seen that sometimes having those really clear drivers and these reasons for getting started can actually make things better, make it easier to get started, start creating data, prove what's possible locally, and then to Nader's point, the culture can then often follow because you've already shown the art of what's possible. So I think, if I had to pick one thing, it would be clarity of purpose, and hopefully that translating through into clarity of message. And a bit I missed out actually is also being sure that and clear that why it's explained to patients that this is happening is true, so that in their lived experience, if they're told that this is going to inform their direct personal care, that they need to feel that that's the case, otherwise they'll quickly disengage. Where patients genuinely feel like that what's happening is what they were told, what their expectations were, you generally get really high uptake and therefore a really low cost of acquisition of the data to be crudely commercial.
Fantastic.
Just add to that, if I could, I do think it's so important to close the loop as well. You know, if you're asking patients to provide patient-reported outcome measure data to their clinical team, they really have to feel like there's some value back. And I guess we'll talk about a little bit about value exchange later in the conversation, right? So.
Yeah, fantastic. Thanks for building on that, Nader. Absolutely, that's an objective of H2O, is to empower patients with their data and give them that valuable feedback. And thanks again, Nader, for introducing this diversity of perspectives. And I want to stick with that one a little bit and explore that in maybe two different areas and lenses. So the first is thinking about, you know, how this is different across geographies and healthcare systems. You know, we often hear said that problems in healthcare are global, but require local solutions. And I would argue that there's many local problems in healthcare as well. And maybe Valerie, I want to start with you, just based on, you know, the widespread adoption of Heartbeat in Germany and the fact that that is one of the H2O countries, to maybe get your perspective on, you know, how this works in Germany specifically, and obviously appreciating that there are regional differences there as well.
You mean just how the adoption or how like PROM in general works in Germany?
Exactly, yeah.
So I think the most important message is that it is mostly still voluntary. So in some areas, the collection of PROs is mandated if you want a certain like certificate, like a prostate cancer center, or of course in clinical trials. But in clinical care routine, it is still being adopted by sort of front runners, so by providers who believe in this whole approach of focusing, just on the patients, basically. That's also like a thought I had when I heard what you guys said about that it's maybe sometimes more feasible, or you had good experiences with not focusing so much on the physicians. It's it gave me a lot of food for thought, right? Because my thinking is always that this transition, and this is what I think we all hope for, that the PROs will push this transition of the healthcare system towards a patient-centric one, sort of move this forward. And just that this might be my physician like view on this, needs to be carried by them, by us, but that is really just my perspective. So, and the way it works in Germany for like us or any other provider is that we just basically get contacted. So there's a lot of interest, and we like demonstrate what we can do. And then we quickly launch into the discussion of like, oh, what instrument, and they all love the SF36 so much. And we have the discussions, and then we quote Professor Rose, who says, you know, what the most modern methods of psychometry are. And then we try to get those people to, you know, use standards, as we heard before, right? I don't know who it was who said patients are so diverse, that's why we need standards in evaluating the outcomes. I really liked that. And yeah, then we just really launch into like sort of a longer project with like contracting all of this implementation. And then once the system is running, it's running, and the data get fed back like sort of immediately to the physicians for them to work on the individual patients, as well as sort of course, analyzing patient cohort data. And if you allow me like one more sentence, there is like a very important law that is sort of has been put out in Germany, the Hospital Future Act. I'm sure you heard about this, that puts a lot of money in digitization in hospitals, maybe a little bit fragmented, but still with this, there is even like a bigger push to PROMs are not a requirement there, but you can put them out in a public tender there. So this is also happening at the same time. Yeah.
No, thanks, Valerie. Really interesting to hear both the kind of bottom up and innovation and top down enabler there as well. Pedro, I want to come to you on this one as well. I mean, as you mentioned in your opening remarks, that, you know, Promptly is focused in Iberia, which means that you're working across multiple healthcare systems and geographies. I'm really curious how you approach that, and if there's any particular challenges you have to overcome there.
Yeah, Iberia is a vague concept. So Portugal and Spain are so different countries, and within Spain, the regions are so different. So adoption in particularly in Spain is we find regions that are clearly front runners and that that have already been doing this before, and that have hospitals and physicians that do it beyond research, so in actual clinical care. And we have regions that are very well developed digitally in terms of digital health, but weren't so much into the concept of patient-reported outcomes and value-based care. And some of our work with them was also in aligning some of the work that they were doing with disease management and digital health into incorporating more patient-reported outcomes in some of those programs of remote monitoring and telehealth. But yeah, similarly to what Valerie said for Germany, there is differences between regions and differences in adoption. And this is what we find the most. One important part in Spain is that each region has its own IT and its own IT infrastructure and its own EMR infrastructure, which is not the case in Portugal, which is very much national based, centralized. So which for this case has been an advantage, I would say, in terms of interoperability with the EMR and so on.
Fantastic, thanks, Pedro. And I think it's your exact expertise managing these or navigating these different local specifications that are invaluable for us in H2O. I want to move on a little bit to another theme, and there's a question that's come in the Q&A that's very much connected to this, and it's around the concept of partnering with ecosystem stakeholders. And I think we heard this very clearly in the previous panel as well, the notion around trust and how valuable it is to partner with different ecosystem players in order to build that trust and accelerate the adoption of these technologies. And perhaps Nadir, I can go to you on this one and maybe ask you to speak a little bit about how you've partnered on your journey with different ecosystem stakeholders, and the questions particularly pointed here at partnering with patients as well.
Yeah, absolutely. I guess there's a lot to say on this. I'll try to pluck out the most important points. So just addressing the question that was in the thread. Definitely, I think the academics, clinicians who develop patient-reported outcome measures very, very widely do develop them with their patients and subsequently validate them in sort of rigorous settings, if you like. I'm not entirely sure that that's the whole picture, though, because just because your prom works, it doesn't mean people want to fill it in, if you see what I mean. And we see a very sort of clear inverse relationship between the length of a questionnaire and people's likelihood of actually completing it routinely and regularly. And so I think that there's a bit of a trade-off between completeness of the information set and the aspiration to have every piece of information we can from every single person we can. We have to trade that off with the reality of people's willingness to kind of play ball. And I don't have a huge amount of experience in terms of designing patient-reported outcome measures. We implement other people's patient-reported outcome measures into our platform instead of designing our own. But we have a proxy as well, which is to say, for those patients who don't want to fill in a patient-reported outcome measure, here is a simple questionnaire that can still give your clinical team in fewer questions and in a less rigorous way the information that they need. So I guess that's just to kind of focus particularly on the question of the instrument. I think that's a complicated. It's complicated whether involving the patient in the design is the same as accommodating the patient's wishes and desires about what the questionnaire should include. I think for me, when I think about why, and I should say, by the way, just there's a lot of different perspectives around this table, you know, whether it's disease specific or disease agnostic, whether it is, you know, kind of partnering with the hospital, the institution, or partnering with the patient as the first port of call. So just to say where we come at it from, we are direct to patient. And so everything that we do in our platform is on the basis of explicit patient consent. And what that means is that we have a big sort of burden of providing information to patients. Not a burden, it's actually an honor and a privilege. We have the honor and the privilege of being able to inform our patients a lot about what we're doing and what we would like to do in connection with collecting data, why we use it, so on and so forth. There's a direct interface to the patient. And I think that that's informed, that full information and the corresponding consent is a really important part of having, you know, of bringing the patient into the circle of trust as well. And the last thing, which, as I mentioned before, I think everybody asks themselves, well, why should I do it? And if there are good reasons for them to do it, and in our case, we think that supporting better self-care through behavioral science and creating community around our platform are two reasons why people stay involved and stay engaged. And as a byproduct of that engagement, they provide their patient-reported outcome measures on time, if that makes sense. So, fantastic. Yeah, let me pass it over to other people.
Yeah, fantastic for that. Thanks very much for that rich perspective, Nadir. Matthias, your hand shot up pretty quickly there, and you know, as our proms guru. So I want to go to you, and then Tom after that.
Yeah, I just, you know, the reason that my hands went up so quickly, because I think, you know, we touched a little bit the situation that the most of the PRO measures, you know, they have a 30-year history, are developed for, you know, scientific use, for aggregated data analysis. So that's where they're coming from, and this was how the field was informed, you know, validated, you know, instrument, and we have a kind of a, I don't know what to say, it's a shrine, but you know, we have this kind of, and we build the field like this, you know, it needs to be a solid assessment, which is obviously still true. But the philosophy of those instruments coming, as I said, from scientific research, so study nurses, you know, extra funding. And now we're in a situation to apply those tools, which has shown to be very powerful in this field, to use this in clinical care. And Tim just mentioned, you know, the endeavors from ISHOM, and I had the privilege to lead one of the ISHOM development sets myself. And there the task is, again, to think what is the best outcomes, so the most solid outcomes. So you get all the experts you can see in worldwide sitting together and have a lot of, you know, brain power there. There could be, you know, to suggest an outcome set. That doesn't mean essentially the same, like it is the best to capture real world data evidence. And as like just Nader just said, there's a road to go scientifically, how we can combine those kind of things which are most appropriate, or which kind of compromise would be the best to get those kind of smaller instruments or more suited instruments to get the data which we really do want to, which is the lack of information which is in the real world. It's not the science world. It's not. So we can go one way, convince our regulators that they, you know, introduce a law. And this, I just can say, share my pain about the cancer registries in Germany. So, you know, it's over years they collect data in the cancer registries, but it's totally, I don't know, I don't want to over exaggerate this, but it's either hard to get it because it's a federated analysis, but it's almost none of the data are used for any kind of meaningful way. So we do have a law. People are, you know, collecting the data. We make a lot of effort. Now it's a clinical effort, but we cannot use it. And that's the danger I see with PROs. So at the moment we are on a hype curve, and so everybody's interested. You get in the higher ranking in Newsweek journal, and you know, and providers, you know, jumping on this because they think this is an advantage for them. And some of you know this much better than I'm. But even at the charity, we are exposed to this kind of ranking list, and I say, well, you know, and it's important that we are at least the top ranking journal in Europe. So that's stuff like this. So which is, yeah, but essentially, it is. There's no content to that. So I think the hype curve, I would assume, is going a little bit like that. And so there, to rescue this, and because I think we do all feel that there is value if we ask the patient about the health status, and to rescue this, there's a long way to, it's not a long way, but there needs to be some investment for also from the content, how we do it technically, but also how we do it psychometrically. I would say, you know, if I put my crystal ball in front of me, it will not be sufficient to use the instruments which have been proven successful in the science world. So I think that's not the way it goes. And, you know, to stress standardization, we also have to think about how we can combine the things which are useful for HTA agency with the clinical use case. And so the standardization needs to go also on the content base, not just on the interoperability, if it is FHIR or whatever it is, but we need to think of something which is smart enough to make it useful for clinical practice. Like if you want to measure depression in clinical practice, it shouldn't be so distinct from the depression which you use for your labeling claim. So that's my, you feel that I'm a little bit concerned that if we just let it go, well, it's fine. I do another project, you do another cool thing in the end. But in 5 years, there will be the decisive point. If we are really convincing that we make the shift at the moment, kind of, well, we get venture capital or we get research money, but that's not the point. I think to go it longitudinal. Sorry.
Thanks very much, Matthias. So I'm just conscious of the time, and I see a list of hands there, which is fantastic. And I think you're heading on one of the other themes I hope to cover, and that's around evidence. So you know, I hope we can, you know, the Valerie, Tim, and Tom, you're able to maybe weave that into your answers on this point as well, and your contribution. And then there's also one question, and I want to plant it now, and I want to come back to it at the end of the time we have together. And really for Valerie, Pedro, Tim, and Nadir to hear all of your perspectives on this. And that's really why, what is your motivation and why are you interested in exploring partnerships with health outcomes observatories? So giving you a little bit of time there to think about your concise answer to that one. And I'll move to Tom.
Thank you, Nick. So I don't really have an answer to that question that you asked in terms of evidence, but it's more along the lines of the second question you asked, and it's probably more prosaic, which is, you know, the fact that we have promptly my clinical outcomes, ampersand, you know, that we have these potential partners around the table is, I think, is evidence that of real interest. And you question you pose the motivation question, but I want to ask a sort of also a quite a pragmatic question: is you're here in this discussion, but do you really believe that we can create the sort of ecosystem that we're planning towards, you know, to create? And you know, do you think that we have our eyes wide enough open about the challenges which are in front of us? So that's I mean, I guess that's also related to the motivation question. So I'd love to hear the comments of the panelists on that question as well.
Do you want me to start, Nick? And I will, I mean, we have, I suppose, 6 minutes, so I will try to be really concise. Many things have been covered. I think quickly to your point, Matthias, I agree. I am less skeptical though, because I do believe that we're doing something different here. We are implementing PROs in clinical routine. We have physicians who immediately use it for the benefit of the patient. So it's actionable data, and I think it will not go away. And I totally agree. I love your example of the sort of the depression. There's one measure for depression, and that gets into the billing and as well sort of as into the medical history. Obviously, and I agree it's a challenge, but I'm positive. And that leads me to, I mean, Tom, that was my doorbell. I will ignore it. I think you have a great setup, and we are very motivated in joining it just because it's just a great project, yeah, to try to collect those outcomes all over Europe with different providers. Already, I've learned so much from my colleagues here, and I think we can pull this off together. Really, just in the interest of time, I'll leave it at that. yeah, so I don't, there were a couple more questions, but I want to give the word to my co-panelists also.
No,
It's in the usual order. In the old order, it was him after me. If we stick to that.
I think, Tim, you had your hand up there, so I'll go to you first.
I know that about 25 new questions have been posted since I first put my hand up, Nick. I'll try
you
and
can take your pick, whichever one you want to tackle.
No, I'm gonna have a go. I'm gonna have a go at weaving them together. So I think I was going to start with a risk, but I think it's actually an opportunity. And I think the opportunity for the Health Outcomes Observatory, this project, is to do things differently. Will it be successful? Jury's out. It's early days, but it certainly seems to be getting set up in the right way. So you are bringing more of the right people together earlier, and there is an openness and a willingness to hear differing views. We've got lots of experience working in the UK system, where often we're needing to address the whims of a registry or a regulator that hasn't been co-created, that has been imposed on organisations, and that therefore sets the data collection exercise up entirely wrong, because it's all about the punitive stick and not the carrot, and it's only meeting one need of one organisation in one direction, and it's not looking to be multilateral. So really excited by how this is being set up. Really excited by Matthias's comments that standard sets that are co-created by well-intentioned academics aren't necessarily going to be what's right, and I think the opportunity is aren't necessarily going to be wholly right. I think the opportunity is to not let perfection get in the way of progress, and realise that software tools, our platforms are soft, and actually we can address the challenges of implementation, the challenges around what the politics that comes out of the analysis means. We can do those things in parallel with actually iterating the data that's collected and the future utility of it. So I think really excited. Really think this could be an answer to this question that folks have been grappling with now for 15-20 years. So good to be in the discussion.
Fantastic, thanks, Tim. So I'll pass to Pedro and then Nadir. Pedro.
Yeah. So great question, Tom. I think for us, the motivation was really the potential for impact that we see in this program. I believe that in a way, all of us in our own geographies, we have been successful in pushing this forward in our context. But what I saw from the beginning, and what our team saw from the beginning at H2O, was the possibility for really going for having an European impact and really starting to have initiatives that are truly European. What I see as risks and challenges, similarly to what Tim said, is the potential to start things wrong from the beginning, and the fact that you have started to inquire people in different countries that were already doing this was for us an initial good sign of having an overarching goal for Europe, but really learning from the local context and what is going well in Germany. That is certainly what is not going. That is certainly potentially different from Iberia and from the UK. So I think that learning and partnering with those that are already doing this in their local context is on our view one good first sign for the potential that this has to be successful.
Fantastic. Thanks, Pedro. I pass directly to you, Nadir, and ask you to be as concise as possible.
Absolutely. No, thanks, Nick. I will just echo everything that everybody just said, so on the money, and I'll hand it back to you to summarize.
Fantastic. We agreed in the pre-alignment session as well that we wouldn't repeat one another when there'd already been excellent points made. So fantastic. I think, bang on the hour. It's been a vibrant and interesting panel discussion, lots of diverse perspectives, lots of food for thought. The only thing to say is to thank you very, very much for being with us today and your interest in H2O and exploring partnership with us. And we look forward to evolving the dialogue and hopefully coming together in many sessions like this in the future. And I see many you've popped up on the screen, so I'm going to pass to you for a few words to close out the entire day one. Many, you're muted.
Just a big thank you from my side as well. I think I think they say that you hear what you want to hear often in life. And I think I really heard what I wanted to hear today during the entire day. I've had a lot of encouragement, both from you, the technology partners, also earlier from the public sector partners. I also heard, and that was very encouraging for me, a desire to advise us and support us, right? Because we said from the beginning, we don't have all these answers here. We have a clear vision, we have great ambition, but we really need to rely on partnerships to make this happen. And I think that's the main theme of everything we are saying here. So wonderful to have you on board. Really, really interesting listening to all of you. And I really sincerely hope we'll have more conversations where we will learn from each other and we'll try to also come up with solutions which somehow are suitable for the various countries, because absolutely Europe is not the same everywhere. So thank you, and please remember tomorrow at 2:00 CET we will be discussing how we're going to create the common language for patients and doctors to communicate in our disease areas of focus. Thank you and have a good evening.
Thanks all so much.
Thanks,
Thanks, everybody.